And it's time for our visit with Dr. Kevin Kavanagh, and he is the founder and president of a national organization called Health Watch USA. Good morning, Doctor.
Good morning, Jack.
Holly and I were having this conversation, and my wife and I were having it last night watching the news, the national news, and yesterday, because I guess the worst day yet in New York City, and lots of interviews with these frontline workers there. And those people on the front line during this war, because that's what it is, are going to come out of this thing with PTSD, don't you think?
Definitely. They're not only going into war, but in many times they're going into war without enough ammo and guns.
Yeah.
So it's an extremely stressful situation. In those hot spots, they do not have adequate personal protective gear. The guidelines which the CDC has given out is really for last-ditch disaster crises, not designed to keep one safe, but to do the best you can with what you got. And they also do not have an adequate safety net. In my opinion, none of this is sick leave. It all should be workers' comp and workers' compensation. Mm-hmm. And one of the problems that is occurring in some of the areas is if they bring in their own mask, or if someone donates one to them, or if they make their own mask, that the facilities are reluctant to let them use it because they're scared of medical legal problems. And that's a huge problem, and it's one of the things that our healthcare system has to deal with. We're fragmented. We're not unified. It's hard to get through all of the red tape that this has occurred, and we're being tied up in things we shouldn't be tied up in. And that's another reason why we need a very strong, centralized government.
Everybody now wants to play the blame game, and I guess in a way it's just kind of human nature. Does it really matter? Well, maybe it does, because maybe the next time we'll pay closer attention. But yesterday there was a big piece on the national news about the president being warned of the possibility as early as January. Is that important?
Well, it is. We're still having problems getting our act together. There is no exit plan. NPR was discussing that this morning. We need to have goals on when we're going to reopen the society, what we have to meet. A lot of these goals would involve testing. It would involve having adequate PPE. It's not just getting over the hump. And we really do need to get a strong, coordinated national plan. I am very scared that after Kentuckians go through this strict close down of our life, that when we reopen in another area or another state that hasn't gone through this strict isolation, we will be recontaminated and have what's called a second wave. And you're starting to hear about that. And all of that can occur because we're all doing different things in this nation. We're not coordinating our response.
Well, Dr. Kavanagh, speaking of a second wave, I have a friend whose sister lives in Hong Kong right now, and she said that they are currently seeing an uptick in infections again. And I was wondering, have you heard any reports about that, like anywhere in China or, just anywhere at all, seeing that second wave?
Well, you're starting to see some concern about that. And basically what it means is, fine, we've isolated ourselves, but if we open up and we go outside and nothing else has changed in our infrastructure, in our healthcare system, and in our testing, not enough people are immune for herd immunity, and the virus comes back. In the 1918 Spanish flu epidemic, the second wave came back in the fall, and it was much more severe than the first wave. So we really do need to get things going. Now, on the positive side is we've got better manufacturing capabilities for PPE, which should be revved up. We've got rapid testing. Abbott just came out with a 5-minute test, and once that gets distributed and we can test our populace, we should know who's carrying the virus, who's not. We've got vaccine development, which is being fast-tracked. So, all of these things are coming on board very, very fast. So it's for us to keep ourselves safe until these come online.
As always, very informative. We appreciate it, and we will be back with you on Friday morning at 9:30. Thank you so much.
Thank you, Jack.